Hello, my name is Suraj Kadam, and we are discussed about action of anticoagulants. Anticoagulants are medicines that help to prevent blood clots. They were given to people at a high risk of getting clots to reduce their chances of developing serious conditions such as strokes and heart attacks. A blood clot is a real created by the blood to stop bleeding from wounds. While they were useful in stopping bleeding, they can block blood vessels and stop blood flowing to organs such as the brain, heart, or lungs if they form in the wrong place. Anticoagulants work by interrupting the process involved in the formation of blood clots. They were sometimes called blood thinning medicines. Although they don't actually make the blood thinner, although they were used for similar purposes, anticoagulants are different to antiplatelet medicines such as low dose aspirin and clopidogrel. The next point is types of anticoagulants. The most commonly prescribed anticoagulants is warfarin. Types of anticoagulants are also available and were becoming increasingly common. They include rivaroxaban, dabigatran, apixaban, edoxaban. Warfarin and the newer alternatives are taken as tablets or capsules. There were also an anticoagulant called heparin that can be given by injection. The next point is when we use anticoagulants. If a blood clot blocks the flow of blood through a blood vessel, the affected part of body will become starved of oxygen and will stop working properly. Depending on where the clot forms, this can lead to serious problems such as strokes or transient ischemic attack, means mini stroke, heart attacks, deep vein thrombosis, pulmonary embolism, etc. The next is treatment with anticoagulants may be recommended if your doctor feels you are at an increased risk of developing one of these problems. These may be because you have had blood clots in the past or you have been diagnosed with a condition such as atrial fibrillation that can cause blood clots to form. You may also be prescribed an anticoagulant if you recently had surgery, as the period of rest and inactivity you need during your recovery can increase your risk of developing a blood clot. Next point is how to take anticoagulants. Your doctor or nurse should tell you how much of your anticoagulant medicine to take and when to take it. Most people need to take their tablets or capsules once or twice a day with water or food. The length of time you need to keep taking your medicine for depends on why it's been prescribed. In many cases, treatment will be lifelong. You were unsecure how to take your medicines or are worried that you missed a dose or have taken too much. Check the patient information leaflet that comes with it or ask your physician, anticoagulant clinic, or pharmacist what to do. You can also call NHS. The next point is things to consider when taking anticoagulants. There are several things you need to be aware of when taking anticoagulants medicines. If you are going to have surgery or a test such as an endoscopy, make sure your doctor or surgeon is aware that you are taking anticoagulants, as you may have to stop taking them for a short time. Speak to your physician, anticoagulant clinic, or pharmacist before taking any other medicines, including prescription and over the counter medicines, as some medicines can affect how your anticoagulant works. If you are taking warfarin, you will also need to avoid making significant changes to what you normally eat and drink, as this can affect your medicine. Most anticoagulant medicines aren't suitable for pregnant women. Speak to your physician or anticoagulant clinic if you become pregnant or planning to try for a baby while taking anticoagulants. The next point is the side effect of anticoagulants. Like all medicines, there is a risk of experiencing side effects while taking anticoagulants. The main side effect is that you can bleed too easily, which can cause problems. The problems are passing blood in your urine, passing blood when you poo or having black poo, severe bruising, prolonged nosebleeds, bleeding gums, vomiting blood or coughing up blood, heavy periods in women. For most people, the benefits of taking anticoagulants will outweigh the risk of excessive bleeding. The next point is the uses of anticoagulants. Anticoagulants are used if you are at risk of developing blood clots that could potentially block a blood vessels and disrupt the flow of blood around your body. This can lead to several serious conditions, and the conditions are stroke, transient ischemic attack, heart attacks, deep vein thrombosis, and pulmonary embolism. And the stroke, where a blood clot restricts the flow of blood to your brain, causing brain cells to die and possibly resulting in permanent brain damage or death. And the ischemic attacks, also called mini strokes. These have similar symptoms to a stroke, but the effects usually last less than 24 hours. And the next is heart attacks, where a blood clot blocks a blood vessel supplying your heart. Next is heart attacks, where a blood clot blocks a blood vessel supplying your heart, starving it of oxygen and causing chest pain and sometimes death. The next, deep vein thrombosis. It is DVT, where a blood clot forms in one of the deep veins in your body, usually your legs, causing pain and swelling. The next is pulmonary embolism, where a blood clot blocks one of the blood vessels around the lungs, stopping the supply of blood to your lungs. The next point is who should take anticoagulants. Your doctor may recommend anticoagulants to help prevent the conditions if they feel you are at risk. This may be because you have recently had surgery, that means you are unable to move around much while you recover, such as a hip replacement or knee replacement. Next is had an aortic valve replacement, as blood clots can form on the surface of new heart valve. The next is atrial fibrillation, a type of irregular heartbeat arrhythmia that can cause blood clots to form in the heart, a condition where the blood has to increase tendency to form clots, thrombophilia, such as factor V Leiden. The next is antiphospholipid syndrome, where the immune system attacks fat and proteins in the blood vessels, causing the blood to clot. Anticoagulants are also sometimes used to treat blood clots such as DVT or pulmonary embolism by stopping the clot getting bigger while your body slowly absorbs it. The next point is dose of anticoagulant. For most people, anticoagulant tablets or capsules should be taken at the same time once or twice a day. It's important to take your medicines as scheduled because the effect of some anticoagulants can start to wear off within a day, like warfarin, apixaban, and dabigatran should be taken with water. Edoxaban can be taken with or without food, and the rivaroxaban is normally taken with food. Depending on your dose, you may need to take more than one tablet or capsule at a time. The warfarin tablets come in different colors: white, brown, blue, and pink, etc. To indicate their strength, you may need to take a combination of different colored tablets to reach your total dose. To reach your total dose, your doctor or nurse will explain how many tablets you need to take, when to take them, and what the different colors means. The next point is monitoring your dose. As we taking warfarin, if you are taking warfarin, you will need regular blood tests to check how quickly your blood clots. This is measured using the international normalization ratio INR. Your INR will be regularly tested at your general physician, surgery, or anticoagulant clinic to make sure your blood doesn't clot too slowly or too quickly. Your warfarin dose will be adjusted until your INR is in the correct range. Your INR may need to be tested every other day at first until you are on the right dose. Once your INR stabilizes in the correct range, these tests will be needed less frequently. Thank you.